Welcome Internet to Psychoanalytic Talk, and today we've been talking about interpretations. So this is a very wide topic. Everyone has talked in some way or another of interpretation. Interpretation is one of the main tools of psychodynamic / psychoanalytic psychotherapy. It's not the only one, it's one of the main ones. So what is an interpretation? Well, very simply, an interpretation is the analyst giving a perspective, a meaning to certain behaviors, relations, emotions, symptoms, feelings, and so on and so forth. That meaning is something that is there to organize the experience of the patient. Of course, not in any ruthless manner, but it's there to, in a way, connect both conscious and pre-conscious and unconscious levels of thought. So, in a way, it's about being able to link behavior with emotion, being able to link what we think and what we feel, both consciously and unconsciously. So that reunification is a very important process in psychology and in psychoanalysis. The thing is, with these processes of interpretation, what we're doing as analysts and as clinicians is fundamentally reshaping and reframing certain experiences, giving them a wider context. What we're doing is we are reshaping them and expanding them to connect multiple things that the patient has experienced. But that connection is not always an easy one for the patient, as it involves re-experiencing certain feelings, certain perceptions, and also it's also sometimes about connecting two things that have been separated for a very long time and for very good reasons, because of survival, because the patient needed to basically split off two versions of themselves, or because some forms of knowledge about oneself are intolerable. So therefore, I should add, and this is very important, that in an interpretation, even though it might be accurate, even though it might be right, is always context sensitive. Not every patient can have every interpretation, even though that interpretation might be true, quote unquote, but I'll come back to that. The patient needs time, both in therapy to be able to develop a secure, benevolent view of the therapist, and also internally for them to be able to grow to a point where the interpretation is no longer something that's cutting into the defenses, cutting through the resistances, but something that is welcomed, something that is in a way accepted within the mind. Because if interpretations are too early in psychotherapy, in the history of the psychotherapy, the resistance are going to be basically pushing back every step, and the psychotherapist isn't going to be able to really go to the very core with the patient, because the patient will resist those interpretations, those quote-unquote connections between two elements. And that resistance can be very complicated, because what you have to remember is that resistance doesn't come from out of nowhere. It comes from decades, years and years of behaving in a certain way in order to survive mentally, in order to be able to cope with daily life. So the interpretation sometimes might force the conscious mind to look deeper into the unconscious. Therefore, it sparks anxiety. Therefore, you have to always be very careful when you're handling interpretations. Even though you might not be, quote-unquote, linking the most in-depth part of the patient with their conscious mind, it's so important to evaluate where the patient's at and where you can basically talk about without triggering iatrogenic effects or iatrogenic effects, i.e. Suffering from the patient's part and the acting out, or for example, suffering or new symptoms might develop because of certain interpretations. Sometimes it's unavoidable because the patient wants to go there, but the conscious mind is basically pulling back a maximum. So sometimes it can happen. But what I'm trying to say is that too early, you're going to spark a lot of resistance. They might even cease psychotherapy completely. Therefore, it's very, very important to really think of what we're connecting together. And also, what I found very important in my own personal work with patients is to get them in onto the interpretations. What I mean by that is basically getting them to be able to think about the interpretations with the therapist. For example, telling them, do you agree with what I'm saying? Do you disagree? Do you feel that something could be added? And what I found very important was to help them to connect to my own interpretations of their behavior. Because even though I conceive of interpretations as a gift, it's also something that can be hard for the patient to really invest if they're not into it. If it's superimposed upon them and they might not be able to connect with it. Therefore, taking them in and their advice and their opinion is very important, especially because, and I really do feel it's essential, because as Bion said, the best interpretations are the one that falls short of being completely accurate. Why? It's because when the patient can then say, wait a minute, you said that, and it's partly true, but there's something else, and I'm going to tell you what that something else is. Oh, yes, it is good, but there's something even beyond that. What is happening is that, the patient is starting to integrate the security and basically the therapist as an internal object. Therefore, they can use the interpretation, but they can grow beyond. For example, I have this image when the patient is able to do that. It's basically like the patient is learning how to do psychotherapy for themselves. At the very moment where they go in oh yes, but there's something more, is the moment where they've internalized the good enough elements of the therapist to be able to do it themselves. And often the interpretations that they then give are even more in-depth, are even more interesting and intricate than the therapist, at least I have felt. And it's always very interesting, and those are the moments where you know that your patient has made intense progress, when they themselves are able to accept what you are saying and build upon it. Now let's come back to, and I said this, the question of the truth. Well, even though interpretations reframe, model the experience of the patient, makes it more digestible for them to have that, it also helps the patient realize that the analyst or the therapist takes what the patient gives them and recreates it and retransforms it and gives it to them in another way. That's the gift. However, the gift isn't the truth. Our interpretations, even though we might be convinced about them, we might feel, oh yes, it's exactly that, we're never sure. It's always a form of educated guess. And I think that's very important, as we have to realize that sometimes we're wrong with our interpretations. Sometimes interpretations lead to nowhere. We are wrong about the meaning of them. We are wrong about the in-depth of what we're interpreting, or we're wrong about how it connects to the patient. And that's okay. Why is it okay? It's because being wrong with one interpretation still opens something within the patient. The patient can still correct the therapist by saying, no, that's not right. That's not my experience. Or, I see where you're getting that, but no. And that is great, because what is happening at that moment is that they're giving us the chance to show them that we can be wrong, that we are flawed, and we are just humans as anyone else. That this idealizes the therapist. The therapist just becomes more human in the best possible way. Therefore, the patient isn't at stakes against the almighty therapist that knows, but they're in front of a human that's trying their best to help them, but that doesn't know, that's trying their best to understand them, but ever falls short. And that ever falling short is exactly the space that the patient needs in order to be able to integrate their own version of interpretations and their own version of the internal therapist, and they can then develop and create something, and that creation is the goal, because if they can understand, interpret, and digest their own experiences, that's the whole point of therapy. And this idea of them being able to reinterpret beyond the therapist, or to use the therapist as just a stepping stone, is perfect, because fundamentally that's exactly what they're doing. And that's the best possible outcome, I feel. And I should also say that interpretations on the behalf of the therapist have also the aim sometimes of, for example, trying to give an understanding to the patient, but also to yourself as a therapist. Like, I think this is what is going on. An interpretation can sometimes be made by the therapist for the therapist. So it might seem not that great, but it's not necessarily a bad thing in the fact that it sometimes helps the patient. It's also important to know that sometimes there is what Thomas Ogden calls candid interpretations, i.e. interpretations that you make, but you're not really convinced by them, but you make them because your mind is elsewhere, because you feel that there's something there but not quite, and these interpretations might not work, might not land, not just for the patient, but also for the therapist making them. And those non-landing or candid interpretations sometimes can open up to something, like something that you had not understood or not really seen, but was still there. Or even something like you're onto something, but like very distantly, right? You're onto something, but it's still going to take a couple of sessions to really get there. And those are also okay. So fundamentally, the interpretation is to be handled with a lot of care. And it's okay to get it wrong. What is worst in my idea is more these interpretations that do not respect the timing or the framing of the patient, that are more like dissecting interpretations, where the therapist is going to try and see what's inside, regardless of how the patient feels about it. I think those ones are the more risky and the worst ones, because fundamentally those interpretations, be they accurate or inaccurate, that's even beyond the question, they break the trust the patient has towards the therapist. And worse, they can also make the patient believe that the therapist is some kind of almighty interpretation machine that sees the truth in them, a truth that is unbearable. Therefore, they can recoil with fear, not just of one individual therapist, but of the whole domain of psychology. And that's why it's so counterproductive, because they are dissecting interpretations, as I would call them, are fundamentally interpretations that hurt the patient. And that's why brutal interpretations, or what Freud called savage interpretations or wild analysis, is something that is fundamentally flawed, because when you're going to go for those wild interpretations with the patient is not ready for that. He might never be ready, and yet sometimes the therapist lowers it, seeing that it doesn't work, but sometimes they force it upon the patient. And that can be disastrous, as all the resistance is going to come forward to prevent the insight. And you're not going to make the patient have insight. Quite the opposite, you're going to build a stronger resistance, because the resistance is not going to fade away. What helps the resistance come down is this idea of non-judgmental, benevolent, and security of the therapist, which is going to give the climate in which interpretations can be made, because they're securing, the setting is secure enough for the patient to be able to self-reflect, to be able to come to terms with their flaws, with their lacks, with their defects. And that can only be done in a certain context. Now, that being said, it's also very important to say that interpretations are a very important set and a very important tool in psychodynamic and psychoanalytic thinking and therapy. But it's not the only one. Often there is a joke that it's the only one. It isn't. There's a lot of things that are not necessarily or inherently an interpretation, but that are still part of the therapy. For example, a lived experience like regression isn't an interpretation on the behalf of the therapist. Of course, they can be interpreted and they can be the result of an interpretation, but it isn't the interpretation itself. And that lived experience is something the patient is going to re-experience and be able to, with the help of the therapist, grow better out of, or to fix something within themselves. Also, the setting, the fact that there is an hour dedicated to the patient, the fact that there is a price at the end of the, or money to be, a payment to be given to the patient, the fact that it's fundamentally, there is a setting, there are rules that protect both therapist and patient likewise. All of these things are not interpretations. There are settings. They can be used as interpretations at some points, but there are realities that in a way secure both parties and give a frame in which the repetitiveness and leads to security. But it's not an interpretation. It's the setting. It's something that's virtually like a third party that guarantees that the therapy will go well, in a way. So, interpretations immensely important and even necessary, but not the only tool. I hope you found this video and this discussion interesting. If you have any questions, feel free to drop them in the comments. I'll see you in the next one.